Do you know 15 out of 100 pregnant women develop hypertension during their pregnancy? What is hypertension? Why does pregnant women develop hypertension during their pregnancy? What are the risk factors? Who are all at the high risk? And what are the symptoms that they can have? What is the treatment? How can we prevent it? Let us discuss all about this in this video. Hi, this is Dr. Abinaya Vijayakumar. I am a doctor and a post-pregnancy coach. For those of you watching me for the first time, I take post-pregnancy classes to pregnant women where I teach them how to stay happy, confident and positive throughout their pregnancy and to connect with the child in the womb using simplified Garbh Sanskar techniques. To know more about the courses, check the description below and reach out to me through Instagram or email. You can also sign up for the pre-recorded post-pregnancy bundle which is now available on TagMango platform. The link is provided in the description. Do check it out. In this video, we are going to discuss all about high blood pressure during pregnancy. Let's get started. So what is blood pressure? Blood pressure is the pressure which is maintained within the blood vessels in order to maintain the blood flow uniformly throughout your body. There are two components of blood pressure, systolic and diastolic. Average normal value is 120/80, but it is always a range. Systolic blood pressure has to be in a range of 100 to 140 and the diastolic blood pressure has to be in a range of 60 to 90. If the blood pressure is more than 140/90, we call it as high blood pressure or hypertension. The women who has a high blood pressure during the first visit itself or before 20 weeks of pregnancy, we call it as chronic hypertension. This means the woman already has a high blood pressure which was earlier unnoticed, but it is found now because of the regular blood pressure monitoring on every visit. But if the women BP was earlier completely normal within the normal range and after 20 weeks of pregnancy, if a woman has high blood pressure, then we call it as pregnancy induced hypertension. Why is this very important? The treatment modality is completely going to be the same. But how early you diagnose and how well you treat it properly prevents the further grave complications of pregnancy on the mother as well as in the baby. Who are all at high risk for hypertension in pregnancy? The women who has a strong history of hypertension in the family, the women who had previous history of pregnancy induced hypertension, the women who has a bad obstetric history of recurrent miscarriages, or the women who is in the high order birth, that is she already has 2 or 3 live children and now again conceived. Elderly pregnancy where the women is more than 32 or 35 years, and some other factors like antiphospholipid antibody syndrome or connective tissue disorder, autoimmune problems. All this poses a high risk for the women to have hypertension during her pregnancy. What are all the symptoms that women might experience if there is high blood pressure? First is giddiness. She might feel dizzy or giddiness all the time. Number 2 is headache, where the headache is not settling within time or it is recurrent on and off during her pregnancy. Then we need to check her for high blood pressure. Third is vomiting. Fourth, blurring of vision. 5, epigastric pain. 6, foot swelling. All this can be a symptom that this woman could have hypertension. So anytime in your pregnancy, if you face any of these problems which are not resolved within some time or it is recurrent, then definitely you have to visit your gynecologist to check blood pressure during your pregnancy. Why are we so concerned about high blood pressure during pregnancy? Because high blood pressure during pregnancy especially poses a grave risk towards the mother's health, towards the baby's health, and towards the outcome of pregnancy as well as labor. Starting with the pregnancy outcome, this woman could face repeated miscarriages or early pregnancy failure a lot, or there could be bleeding on and off in her pregnancy. There could be some issues with the placenta sometimes if the blood pressure is constantly high. Moving on to the delivery outcome, this could lead to low birth weight babies, stillborn babies, premature preterm babies, or complicated labor. All this can happen when there is a hypertension in pregnancy. And when it comes to mother's health, mother has a higher chance of going into pre-eclampsia or eclampsia if the blood pressure is not under control. Pre-eclampsia is nothing but along with high blood pressure, she will have protein in her urine which we call albuminuria. And what we call as eclampsia is when a woman has symptoms of hypertension along with protein in urine and she throws a fit, then that is called eclampsia. This could be life-threatening for both mother as well as to the child. So if a woman is at higher risk of hypertension or if a woman is found to have hypertensive during pregnancy, what are the dietary advice that we would advise the mother? Salt restricted diet is very, very important throughout her pregnancy. Avoid any type of salted, spicy, oily, junk or preservative filled foods, processed foods or packed food items in order to be on the safer side and to avoid potential complications. So what are the warning signals that a pregnant woman who has hypertension should be aware of? One is a leg swelling which is not going off even after a good night's sleep. Most of the physiological leg swelling will reduce and will be completely normal after a good night's sleep. But if the leg swelling is consistent, it's not reducing over time, then she need to check for blood pressure in her pregnancy. As I've mentioned earlier, blurring of vision, constant or repeated headaches, vomiting, epigastric pain, seizures, all these are warning signs that the woman can have hypertension and she has to check her BP immediately. So once the woman is found to be hypertensive, she would be started on medications to control her blood pressure along with dietary advice, lifestyle modification, and she need to be consistently monitored in order to see if her blood pressure is well under control. I hope you found this video useful. Do share it with another pregnant woman who is at a higher risk or who is already found to be hypertensive in her pregnancy, such that she is aware of all the warning signs and she reaches to her doctor at the earliest. Do hit the like button if you loved this video and found it very useful. Also, do subscribe to my channel and press on that notification bell icon. It doesn't cost you much time, but it definitely matters a lot to me in order to stay motivated to provide consistent value in the upcoming videos. And also comment below your doubts about high blood pressure in pregnancy. Until I meet you in the next video, stay happy, stay mommified.